Hey,
Hey,
buddy, how
how's
you
it
doing?
going, Jason?
Doing well. How about yourself, Nick?
It's same as I was 5 minutes ago. Oh, that good old record button.
Yeah. One day I'll remember to press that record
One
button.
day.
Yeah, one
So,
day.
so how was your week?
It was good.
Yeah,
I ended up having on-site week at work, so we did some volunteer work and
people,
had to be around
people.
people and
Oh,
face-to-face stuff. It was weird. And then ended up spending some time at Wekiva Springs, which was kind of cool. And the volunteer work was at a food bank, so that's pretty neat.
I bet you feel just all warm and fuzzy on the inside when doing your volunteer work. I think,
Yeah.
did you get to see the people you were helping, or was it like,
Yeah, no, it was at a food bank, so we were packaging meals in boxes. So we basically got a box on a conveyor belt, and then it was sent down. And I was like fifth person in line, so I had a pallet of canned vegetables behind me, and basically my job was to put one can of vegetables in each box.
did you get
And
competitive? Like, boom, man, my canned vegetable went in fast. Hey, come on, carton of milk, let's go. Come on, we can do this. Give me two.
uh,
Give me two cans.
Not competitive because it was moving pretty quick, and also we had to go in order. But the part that was probably the most frustrating, I guess you could say, is the people in front of me were not stacking stuff in there. They were just kind of throwing it in. So when it would get to me, like everything had to be stacked tight for
Right.
all 13 items to fit. So I mean, we got like half-pound bags of rice and like crazy stuff in there.
That's
So
awesome.
yeah, so it was awesome. But yeah, so like myself and my buddy next to me were trying to like fix all the issues from people before while also getting our can in there. So
Come
like
on,
halfway
Nancy,
through I
stack
was
it in
like,
there, Nancy. What are you
yeah,
doing? Come on.
exactly. So like
Ah.
halfway through I was like sweating, and like I was like, I'm ready for this to be over.
Just
But it was
doing
good.
I
I
can
mean,
do this. I can do this so much easier by myself. Come on. Come
yeah,
on.
exactly. Yeah, no,
Oh,
but it was good though. I mean, it's for a good cause,
yeah.
and
So you got the warm
we
and fuzzies, huh?
yeah, yeah, it feels good. I used to do a lot of volunteer work back in high school, and I think when I graduated high school, I had over 400 hours of community service.
Wow. You
So
make me feel like a
yeah,
bum. Like, that's awesome, Jason.
yeah. So
Wow.
it's good to get back every once in a while.
Yeah. Wow.
Yeah,
Warm and fuzzies, man. That's awesome. Like,
yeah.
I'm proud of you. Look at you
Oh,
giving
thank you,
back
thank
to the
you.
community.
Yeah. Well,
Oh,
how did you get back to the community last week, Nick?
I went on a vacation.
Oh, there you go.
I gave back to my community of women that I live with.
Oh,
And
there you go.
yeah, we went on a 7-day Disney cruise. We went to Cozumel, Grand Cayman,
That is
and
awesome.
Jamaica. It was so fun. I got to kiss a dolphin.
Oh, that's
Like, I
cool.
got to like dance with a dolphin. Did you know? Fun fact that a dolphin sheds its skin like every 2 hours.
Really, I did
Isn't
not
that
know that.
isn't that
That's kind of
fun?
crazy.
Like I love learning stuff like that. It's like, man, like wow, 2 hours. And
Yeah.
it was really neat. Like the trainer showed us, like she showed us like on the fin, and it almost looked like if you had like a sunburn, and then
Mhm.
sometimes like it's like that day 3, and you just kind of like the skin just kind of beads up a little bit. It was just like that. But she goes,
That's
they're in the
awesome.
water, so it just kind of flakes off, and it's
That's cool.
yeah. So I was like, I even asked, I said, so like, are there like just like I was thinking like snake skin. Like I'm like,
Mhm.
is there just like dolphin skin, like
Right.
just swim out of it? And she's like, no. It flakes off. I was like, okay, good. That would be really like, could you imagine swimming in the ocean and all of a sudden you're just like flap flap like against your face? It's like, oh my god,
Yeah.
it's dolphin skin.
I'm pretty sure if I was scuba diving and saw that, I'd freak out there a little
Be
bit.
freaked out, right?
Um, yeah,
So
but
wow.
that's cool. Did the girls get a chance to also swim with the dolphins and stuff?
Yes. So Juliana and Sophia got to swim with they. I was an observer,
Okay.
so they got to do everything. But it was really sweet. At the end, the lady was like, "Oh, like," because I was trying to, I'm Mr. Dad, and getting in with the kids and stuff. And she's like, "Oh, do you want to kiss a dolphin?" I was like, "I mean, how often do you get a chance to kiss a dolphin, right?" So like the dolphins kissed me on the cheek, and then like I turned and I was like, "Oh, Seymour, you're so good, like this," and then all of a sudden the dolphin swam up and got me on the lips,
Oh,
and the
nice.
girls started laughing. Mia couldn't get in the water. She's like, up on an observation deck. My daddy just kissed a dolphin on the lips. Like that was on the cruise. It was one of two things. Hi, I'm Mia. My mommy has a baby in her belly. Or hi, I'm Mia. My daddy kissed a dolphin on the lips.
Yeah, that's awesome. That's awesome.
So
Oh,
yeah,
that's so cool.
yeah. So that's awesome. So I got a funny story to tell you because I know we have an amazing guest coming on that I will intro in a second. But I know every week I like to have a little bit of a cocktail with my buddy. And I built this bar. I used an old Victrola case from like 1906. Took all the guts out, but the top, like it looks like a Victrola, which is really cool. But I was like, oh, I'm going to be fancy, and I'm going to put my stuff in decanters. Like this is fantastic. And I always have this thing like present Nick needs to set up future Nick, so that way future Nick knows what present Nick was thinking, if that makes sense. And I didn't. So I have like 3 decanters that I stare at, and I'm like, well, that smells like whiskey, but I don't know what kind. So I'm drinking an unknown. It's either a fistful of bourbon or American honey. I don't think it's American honey, but yeah, it's an unknown bourbon I'm drinking, but it's tasty.
So the cool thing that you can do with that, so I have a bottle here of it, is it's called an infinity bottle. And what you do is you take, like, when you get low on all of your whiskeys
Yeah.
and bourbons, you just take the last, like, few ounces of it and you pour it into the infinity bottle, and it makes a blend basically. So it's kind of like how you would do blends on like Scottish malt blends, whatever else. So it's kind of a big thing in the bourbon community. Like a lot of the people in my Facebook group do that.
So, well, Jason, like I said, you are in for a treat, sir.
Yeah. Who do we have on this?
Details Untold has a superstar waiting in the waiting room. This person is my brother-in-law, who I've known for 15 years. He wasn't always my brother-in-law, but he is now, at least for 10 years, because it's going on 10 years this year. But he is a son. He's a brother. He's a brother-in-law. He's a husband. He's a dad. He's a doctor. He's a world traveler. He's a drummer, a published author. Let me introduce Dr. Andrew Bonett.
Hey. What's up, guys?
How's it going?
Hey there, Andrew.
Good. Hey, how's it going?
Going well. Appreciate you coming on.
15 years. Can you believe it?
I no.
I mean, yeah. Like Kaylee was 9 when we met. Like, and now, like, right? Like, and then like your dad said the other day, like they've owned the condo for 15 years. So I'm condo old.
You're okay. Like, that's easy to remember.
That's easy to remember. So now, Andrew, where is that?
Yeah, another thing I was gonna say. Shout out, go Gators! Love the shirt.
I know who my guests are. Now, Andrew, where are you at, sir, right now? Tell our listeners.
I am in Naples, Florida, where I now live and practice, and this is my backyard. You could probably hear a dog barking.
That's fine. We actually all got dogs. I got 2 dogs in the room. Yeah. Jason's dogs were howling because they were excited to talk to you. So,
yeah, good deal. Yep. So we're loving it back in Florida after a little while going around the country with training, but now we get to enjoy these beautiful evenings.
Oh yeah, it is really nice outside. So now, listeners, Jason is in Florida too. So he's loving the beautiful evenings. I'm in South Carolina. Actually, because of Andrew, I'm going to blame Andrew because you had a residency here like 10 years ago, and we started visiting.
Yeah. 14 to 19. I was in Greenville, South Carolina at Prisma Health.
Yeah.
Which you guys might have never heard of Greenville. If it wasn't
Exactly.
For that, huh?
Exactly. We would have never heard that, and it's funny because but it is growing. People love it here. We would come visit Andrew, and it was like one of those like we were famously like, oh, we'll leave on Thursday, and then it was like, oh wait, I can we'll leave on the weekend. Like it's okay, we can stay another day or 2.
Right.
Yeah. So that's awesome. So Andrew, you are an amazing person. That's why we have you on here. You're sitting here in your scrubs. You came home from work like 6 hours ago. Like you just check in, say hey, but you've been hanging out in your scrubs for the show. No, I'm kidding. Andrew just got home. Like that's why I wanted you on here. Like we're fascinated with everything that's going on. I've done my research on you, on top of what I already know about you.
Oh, you learned more?
Yeah, we have an intern. That's me.
Yeah.
I'm my own paid intern because I
Yep,
used to
yep.
intern on another podcast, so it's just embedded in me. So yeah, so that's awesome. So I appreciate you taking the time out to talk with us today.
Of course. Thanks for having me.
Yeah. So a couple things. Let's start when Andrew was a wee child. I got a couple things here. Hip hop lessons. You used to take hip hop lessons? Was that when you were a wee child or
Yeah,
an adult?
You know, not as young as I'd like to say.
See, I know Andrew.
Yeah. Well, your
And
wife,
your family too. So
my sister, was part of this dance studio her whole childhood, and I just was going to the lessons, and or the what practices or
practice. Yeah.
whatever, getting ready for the recitals. So, and I was going every year. And then my mom convinced me, listen, you're a good dancer. You crush it at the weddings that we go to. And I'm like, what, 8 or 9 years old, you know? She's like, I think you really have a real talent for hip hop.
Right.
So
When these other kids are dancing and they're just jumping, like you're actually busting a move. Like,
yeah, I don't know. We're talking about, dancing to the early 90s hip hop at the weddings.
right.
Um,
Now.
So I did, yeah, she signed me up. I did one season or whatever you call it with the hip hop where, I was the token only boy
Right.
in the class, and we dressed up in these like jailbird costumes
Okay.
and danced to the Puff Daddy Biggie remix at the time with More Money, More Problems.
Yeah. So
So
now I got to.
there's a VHS out there somewhere for Blackmail.
Oh yeah, they just made their way up here. I had to unload them from your mom's van, so they're
good.
here. There's evidence. But I do have a question as a dance dad. And Sophia has a boy on her team, and like you said, the token boy. And I've noticed going to competitions that there's like either the token boy that knows what he's doing, and like he's front and center, or there's the boy that's just doing it, and they kind of use him as a prop.
Yeah.
Like he might come out and do like one twist and turn, and everybody's like, "Yay!" Or like he's like the main. What were you? The prop or the main?
I don't feel like they used me as like a prop for any solo move or anything. I was probably in the center just for better symmetry with everything.
Right. Okay.
But I don't know. I was keeping up fine. I was fine. But they weren't like making me do my own little solo. Watch this dude do his own thing.
So you gave up after a season, huh?
Yeah, I went back to the sports. I don't remember how I had time for that because I was usually playing sports growing up. But
and talking about sports, I mean, we got baseball, we got basketball, we got football. I mean, all kinds of accolades with your football career growing up, right?
Yeah, that was fun. That was my number one sport.
Yeah. What'd you play?
I started when I was like middle school age. I was a running back, and then once I got to high school, I was more of a wide receiver. So yeah, it was fun. I played Winter Springs High School in Orlando.
Nice.
Class of 04, so it was already 20 years ago.
20 years ago. No, 2000, 2000 was like 5 years ago, Andrew. I don't know what you're talking about.
I know. But it was nice. We had a nice little run in the playoffs. It was fun. And then that, I didn't play any collegiate, just out, intramurals, fun, flag football, stuff like that.
Right. But Jason, do you want to hear some stuff? Andrew is a surgeon, right? And when you do surgery, you don't cut people open with your nose or your toes or your elbows. You use your hands, right?
I didn't know that, Nick.
Yeah. And bro Andrew is playing, we'll say even recreational football while going to doctor school. That's not the right term for it, right? Like,
Well,
like the
that's
man
what you
is
like to call
taking his like I remember when you were here, you were like, oh yeah, I play with the Y, and I'm like, but your
Yeah.
hands, Andrew, your
You know what's worse?
hands.
You know what's worse? I did boxing classes for a little while.
Oh
Wow.
my! What would have happened if you would have broken a finger or two?
Yeah,
Like, did
I
you think
mean,
about that? Like,
I obviously
you,
I wasn't trying to break the bag. I was trying to be smart about it.
right?
Uh,
But you could have caught a football wrong. I
yeah,
mean, that
I did.
happens.
I did. My
Oh my
intern
god!
year, my intern year of general surgery training, I caught a football wrong, snapped this tendon in my finger, and it dropped. I had to rehab it for a while, and honestly, really lucky it didn't have any long term
Well, I guess if you're
issues.
playing in the intern year, you're around a bunch of people that know what the hell to do.
Well, that's
Oh,
the
wait,
thing.
he tore a tendon. Let's get in there. It's fine. Da-da-da-da-da.
Well, I was it was in the morning, and I was what we call night float. I was working the nights the whole month, and I was going in like 6 hours to do the night shift, and I just called up one of the ortho guys who was also an intern and immediately got an X-ray, and he diagnosed it, and he gave me the splint I needed, so I had treatment in within 6 hours of the injury.
Wow.
So there's perks for being
Yeah.
around that kind of setting.
But like when you're playing though, like when that happened, did the thought cross your mind like, holy shit?
Oh yeah, like immediately.
Like,
Like
oh
my
my god.
whole career. Yeah. Yeah,
Yeah.
because I didn't know it was wrong at first. It was weird because
Yeah.
it didn't hurt, but my first thought was like long term. Actually, my first thought was probably as the intern is I'm going to be in so much trouble if I can't do my job. You
But that
know,
was before you went to surgery, right? That's before you got into surgery and plastics. That
that
was just your general
that was intern year of general surgery, so I
surgery. Oh,
still
so you
was
still needed it.
expected to be in the operating room to help with cases and to be able to. As an intern, you're more like running the
The,
floor and seeing,
right.
but still, there's a lot you can't do with a bum
With
finger if you can't even scrub in.
Now, did you get in trouble?
So, no, well, no, everything was cool. I had to actually, you can't take the splint in the operating room because you have to, you scrub in, you can't have anything on your
Right. Yeah. You
hands.
can't. Yeah.
Mhm.
So what I had to do was take off the splint, scrub in, support my finger until I got to the table, and then I had them fashion a sterile tongue depressor and steri strips to splint my finger during surgery and then put my gloves on.
Wow.
Wow.
I had to do that for 4 straight weeks.
Wow.
Jeez. That's fun.
So, but all
Wow.
is well. All is well.
But so now talking about your hands while we're at it, like now that you're board certified, congratulations on that.
Congrats.
Are your hands insured?
Yes. Actually, they have been since for about 5-6 years now.
Wow.
How does that like? Is that like buying car insurance? You're just like, here's my hand. It's so pretty, and this
Yeah.
is what I do, and I need you to insure them.
There's actually something pretty common called just disability insurance in general. And a lot of surgeons have it, and basically it doesn't necessarily specify all the time a body part, but if I get disabled to a point where I can't do my job, it sets you up with an income if that were to happen, basically. And then there's different levels you can buy. So for example, if you want to like pay more premium,
Mm-hmm.
you can get a better income if you get injured. Whereas if you want to pay less, it might be like, well, you can't be a plastic surgeon, but can you still be a physician? Because
Right.
we're not going to give you all this if you can just go be a radiologist. So then
Right.
you're stuck doing that, but you'd still have to start over in a new training program or something.
Jeez.
So that would be kind of rough. But I do have some form just in case anything crazy happens.
That's wild. That's
Yeah.
wild.
That's crazy.
Having your hands in, like you're just like, babies, don't let me down. So are your football days over right
It's
now?
not-
Like,
They are right now. Honestly, it's not for my hands. It's just because now that I'm so old and I've known you for so long, you get too many aches and pains and things injured too easily. I think the
Right.
last time I played a flag football game, I broke a rib or something too. So I'm just
Oh, wow.
like, let's not
let's not
yeah.
test it. Like, don't stop living, but let's not,
right.
come on.
I miss it though. I miss playing. organized
now
sport.
you just went, but you went skiing though in Switzerland. Like
Yep,
that's
yep.
another again a high speed. Like you're just toying here, Andrew.
Yeah, I mean, snowboarding, it's actually even worse because you break your wrist more often snowboarding. Um,
Yeah, like, break your
calculated
ankle or break your
calculated
leg. You
risk.
can still stand. You can still stand at a table like
That's
that.
true.
Like
I know. Yeah, but like you said, not don't want to stop living. So
Yeah.
I think a lot of surgeons tend to be very active people.
yeah.
And so a lot of them do that kind of stuff. Like my senior partner slash boss, he goes skiing 3 to 4 times a year.
Wow. I guess it's a
Wow.
calculated risk, right? Like if you're
I'm
like
not
you guys grew up skiing or snowboarding and all that stuff, it's like
some.
you're a
I'm
little
not going.
you
Yeah,
know.
I'm not going to the terrain park. Just
Right.
having fun.
Right. Like I've never done it before, so I would never do it because like you said, we're old and I'm worried about breaking something.
I know. Well, and I've already
Wow.
done it. I broke my wrist the first time I snowboarded.
Oh, wow.
Another thing I feel like I narrowly escaped being able to do this career, but so
Wow.
I'm done with those risks, I guess.
Well, that's good. We're glad
Cheers,
to have
by the
you.
way.
Yeah, what are you drinking?
This is a little wild turkey rare breed rye.
Nice.
Ooh, I think I might be drinking wild turkey. Did you hear? I don't know if you were on already, but I put something in a decanter and I forgot. I didn't label it, thinking I'll remember what I put in this random square decanter in my bar. And I smelt it.
You
It
weren't
smelled
sure
good.
what it was.
I'm not sure what it is. It's good though, but I can't tell if it has a honey flavor, so I think it's my fistful of bourbon. It's called. So yeah. But I'm a wild turkey.
Yeah.
I'm a wild turkey honey guy. I like that honey flavor. It's nice.
Yeah,
Yeah, Wild Turkey makes some good stuff.
Yes.
yeah, they do.
Yeah. Jason's my bourbon guy, my whiskey
Yeah.
guy.
Yeah, I probably got like, I don't know, 25, 30 different bourbons at home. So I used to go crazy collecting it. So I got some. I don't have any BTAC, but I got like Blanton's straight from the barrel and gold, and I had a bottle of the Japanese version for a while, but that's gone. And then I got some like Eagle Rare and yeah, different ones. So I don't know. I'm a big bourbon drinker.
He's my collector guy. Where I'm like,
Yeah.
is it 25 and under?
Right.
That's awesome. So now, Andrew, let's go through some of this here. Accolades. I don't have all of them because it's only an hour show. Okay. So I had them narrowed down. Academic Resident of the Year for 2019. You were Ashmore Video Award 2019.
Oh yeah.
Alpha Omega Alpha Medical Honor Society. You were UCF College of Medicine Academic Excellence Award of 2012. You were a member of Pi Delta Theta. If I said that correctly. I don't speak Greek, but I went for it.
Yep. Fight out.
And you were the second graduating class of the UCF College of Medicine. Like that's gonna be pretty cool, right? Like
Yep.
that's like the first floor. Like not the that's awesome.
It was cool. It was cool. We were so the second class was also within the first 100 students. They had 40 their first charter class and 60 the second. So I was that second class and the first one to go to their new facilities down in Lake Nona, which were finally finished at the time. So that was pretty special. And now I think it was just this past year they finally graduated their 1,000th doctor.
Wow.
Yeah.
That's awesome. That's really cool to be kind of like, to be in at the beginning, right? Like that.
It's
I feel
cool.
like you get a little bit more special care and you get a lot of like neater professors and doctors and stuff like that compared to, I'm talking out of my ass here, but compared to like 10 years from now, they're like, meh.
Yeah, it's cool. I mean, no, they did bring a lot of the best to start that school, because some people might have thought like at first when the school opens, it's not accredited fully. It can't be. It has to go through. So people were scared about that. But the people they brought in to start that were coming from some of the best schools in the country. So it was a great experience.
Yeah. So, okay. So let's see here. So you're in a fraternity, right? Is that like does
I did.
that last forever, or is it you were in a fraternity or you are in a fraternity?
Yeah. Well, I guess in a way it lasts forever. I'm not. What doesn't, they consider you an active member or not. So I'm not an active member by any
Right.
means, but
But you can legacy in, huh?
you are forever a brother in the bond, is what they say. So,
So
so
that's
yeah, I
awesome.
was Phi Delta Theta Florida Alpha chapter. They called it. It's the first one in Florida in Gainesville. And it's still going strong. I'm not going to pretend I'm super active in it, but I was at the time. I was at the
But you were
time.
at the time, yeah.
Wow,
Yeah.
that's cool.
So that's crazy. Okay, so backtrack. I'm sorry, I'm jumping all over the place because you're just like, wow. Jason, the amount of schooling like just stopped, right, for Andrew. Well, technically, being a doctor, right, it never stops. But like you are now out of school.
That's yeah. The joke is definitely that you don't have an adult feeling job
Right.
until you're well into adulthood. The thing is that there's all the school. You do your undergrad, and I did a master's, and then 4 years of med school. That's when you get your degree. You're an MD or a DO, whatever.
Right.
Mhm.
But then you have to be trained in whatever specialty you're going to go into, whether it's ER, family physician, surgical specialties, and that's different for everybody. So the quicker residencies like ER and family medicine are just 3 years. So med school 3 years and you're done. You get a job
Mm-hmm.
for the quickest thing there is. Of course, I chose one of the longer routes because why not?
Now, did
And
you always want that? Sorry, I didn't mean to cut you up, but did you
I
always want to go
oh
plastics?
well, I was 100% going to be a orthopedic surgeon. I thought sports medicine. Growing up loving sports, and thought like my dream job would be like a team doc, like
Right.
the guy on the NFL sideline. So I went actually halfway through med school thinking that, and then just didn't really know kind of the breadth of plastic surgery until I did it as an elective.
Mm-hmm.
Started to have a change of heart about halfway through med school, so that was kind of tough to realize that.
Now, what hit you?
What
What
was
made you
it?
change? What did it for you?
It was the actual surgeries themselves, for the most part. I didn't love the surgeries, honestly, orthopedics.
Mm-hmm.
Um, the other thing is that they tend to get really focused nowadays with these specialists. Ankle guy,
Mhm.
shoulder guy.
Mm-hmm.
I didn't want to be super narrowed like that. And then with what I thought I liked with the sports medicine, that's a lot of minimally invasive arthroscopic stuff. So you're making these little tiny incisions. You're working in a little box the size of a die.
Jeez.
It's great. I'm glad they're doing it. That's what
Right.
I want if I need it. But
Mm-hmm.
I didn't love that, and obviously that's one of the most important things is what you're going to be doing on
Right.
your fun day. The fun days are supposed to be the operating days.
Right.
So just seeing plastic surgery, and really a lot of it was the reconstruction side of it that I didn't
Mm-hmm.
know about, and it's just really cool surgery, a lot of finesse, open exposures and dissections, and it's head to toe, and you can tackle anything. And so I loved that, kind of the problem solving of it, and being able to have such a diverse number of things that you do.
Right.
So I started just seeing that more and more, and I went to general surgery first. General surgery residency is 5 years, and you can specialize after that. And so that's what I did. And then
Wow.
plastics was another 3.
Jeez. So I got two questions, and then we can
Yeah.
kind of go from there. So I just want to fill in the listener and Jason. Like when we're saying plastics,
Mhm.
I think you know what goes in. That's like a stereotyped term, right? Like when everybody says plastics, you're just like ugh, boobs and butt, right?
Yeah,
But
nip
like
tuck.
Jason, like Andrew showed me, like I when I was a teenager, I was like the kid that would stay up till like midnight and watch like the health show that would do like all the surgeries. I'm like, yeah, like this is great. But it's funny, like in person, I'd probably pass out. But like, so like when I was with Andrew, like he was showing me like one of his medical journals and stuff like that. Like plastics isn't just boobs and butt. It's like he said, like reconstruction And like he showed me, I'll never forget, not because it like scarred from it. It was just so cool. You showed me where somebody had something wrong with their hand and they sewed it to their chest to like reconstruct it, like to have the skin grow and like that's some really cool stuff. Like that's not like so it's you're not stereotyped, right? Like it's like that's really cool kind of things that they can do.
Very cool, very cool. And like you said, it is what the media exposure is and stuff like that. So even as a medical student, I still didn't know that all of that was reconstructive surgery, that was under plastic surgery. One of the reasons I didn't think I was interested in it was because I just thought it was mostly cosmetics. So until you see with the exposure, and a lot of it is reconstruction, whether it's from trauma or for cancer, a lot of breast cancer, of course, because it's so common. A lot of orthopedic sarcomas, a lot of skin cancer, especially down here in Florida. So I deal with reconstruction of skin defects all over the face, the head and neck, or anywhere. Chronic wounds. I mean, you name it. But that's what keeps it fun. It's literally head to toe.
Like you just get to feel all warm and fuzzy after work. Like like I gave them confidence back, right? Like it's not just surgery. It's a confidence. Like you were because we're as a society, we're very vain, right? Like, it's like we always want to look good, we want to look our best, like nobody wants a scar across their face. And you finesse it. You said that you finesse it to where you take that away from them. Or like you give it, I shouldn't say you take it away. That was bad. You give them their confidence back. Like I remember when we were down for the birthday, Jason, we're at a birthday, and he's like, I'll be right back. A kid got bit by a dog, and it's like, holy shit! Like he just changed that little girl's life.
Yeah. I mean, like you said, it's for the standard adult cosmetic patient. You're giving them some rejuvenation, some confidence back, but like you started to allude to, I think a lot of the gratification comes in with the even more life-changing patients. That kid who is the difference could be in all of their social interactions throughout grade school.
All of that. Right.
There's a lot of it's more function than cosmetic appearance too. I mean, I saw a patient today that he's finally just able to walk again because of a knee reconstruction that I did and a foot reconstruction that I did. And they're getting them back to doing their favorite hobbies like going fishing, and they couldn't do it with an open. Yeah. So that's huge.
God, you just must awesome. You just must come home like a ray of sunshine. Like,
well, I wish that was every day, but
yeah. Well, like I know, like every day, but that's kind of like, I mean, does it? Like, do you feel like just like when you do like a good stitch and you're just like, yeah, that ain't gonna scar. Like, does that like that was a damn good stitch right there. Like that ain't gonna come up. Like they're never gonna see that,
Yeah.
To giving their you gave somebody their function back.
Yeah.
Right. Like I feel good when I can make somebody laugh. Right. Like anybody can do that. Right. But like you gave somebody walking. Like they can walk now because of you.
Yeah. No, that's the best part. That's what it's all about for sure.
Wow. Have you ever had, or maybe multiple times, like, have you ever had like where you just broke down afterwards? Like, did you ever get like emotional about it? Like, not bad emotional, but like it just kind of hit you like what you did for that person?
Yeah, it unfortunately in a way it starts to get used to that. So it's maybe not positively emotional necessarily, but it is good when you're seeing a patient for that post-op and they're just so grateful, and yeah, that feels amazing,
right?
To see that patient
smile on their face, and they just
will tell you my life has changed, and I either feel look but like feel a million times better, and I can't thank you enough. That's why we do it.
Yeah. Are you a hugger? Like, do people just want to hug you? Don't they? Like, they just want to like.
Oh yeah.
My God.
Yeah, wow. I'll go for the hug. I'm Italian.
That's wild. Oh my gosh, Jason, do you want to jump in? You got anything?
You
Because
just mentioned as a
I got my
chaperone.
part
Drew.
2.
Yeah, so I work in IT for healthcare, and one of the things that I've done in the past is had to like go in different surgery rooms and stuff to fix computers and
Oh yeah.
other components when things are down.
Mhm.
I cannot be around blood. Like I love the idea of helping people and doing that stuff, which is one of the reasons I work in in healthcare IT specifically, rather than like for a big IT corporation. But
Yeah.
like I can't be around the blood, and every time I'm around it, I just want to throw up, and like I just get sick to my stomach, and that's hospital smell, like the
Yeah.
sanitization smell that's out there and everything.
Right.
So when you were in medical school, like
Yeah.
how many people had to drop out because of that?
Nobody. I don't know. I think you're born with it. I
Yeah.
don't know what it is. You're either
So it
born with
never
it
affected
or
you.
not. Never affected me at all. But now I've seen medical students actually faint in the operating room.
Wow.
But the reason that happens is, regardless of what you're going into, they make everybody rotate through everything.
Okay.
So I had to rotate through surgery, which was like my favorite 12 weeks of third
Right.
year, but I had to do psychology or psychiatry, neurology, neurosurgery, pediatrics, internal medicine, everything. So you get that person who doesn't really like blood and they're going to maybe be a, psychiatrist.
hmm
They have to
Oh my
do
God, could you imagine that?
surgery. They have to be in there.
Oh
And we
no.
tell them like, hey, listen, we tell all the medical students, if you ever feel lightheaded or something, just don't be brave. Grab a seat, scrub out. Who cares? We don't want you to hurt yourself.
Right.
Happens every year.
Wow.
Bam, just bam. But obviously I wouldn't be doing this, but I never even thought about it. I just always found it fascinating, the human body and anatomy and everything. And I don't even think about it anymore. To me, blood just is in my way of finishing the case. It's like
Yeah.
I want to stop bleeding so that there's no issues with bruising or bleeding or
Right.
hematomas. So for me, blood's just like a nuisance. I don't think about, oh my God, it's somebody's blood.
Yeah.
What was the first thing that inside somebody that you saw? Like, was it like intestine? Like when like what was the first
Probably a rectum.
body part? Like, what was like?
No, I think. Well, okay, saw like ever when I was a medical student.
Yeah, like when like one of the classes you walked in and they're like, okay, step up to the cadaver and here, Andrew, hold the stomach, and you're just like, oh God, like,
I'm trying to think when that would be, because I shadowed a little bit even before I got to medical school just to see. So, it's probably an orthopedic surgeon doing either a knee replacement or a arthroscopic joint surgery, seeing something like that. But I do remember the rectum part was my as an intern, you get your first like case. It's never going to be like a big case, but the first one I was ever assigned to was just to go do a colonoscopy, which was not super exciting, but technically that was my first case as a doctor.
as a doctor. Wow,
Yeah.
there you go. That's something to remember.
Yeah, I guess so. I guess I never forgot it.
Wow. So Jason is in IT, so he types on a computer, and that's like second nature to him. You having your hands inside somebody's body is like eating a bowl of cereal. Like it's not anything.
Exactly.
Wow.
Yeah, like sewing,
Yeah.
like stitching, sewing. I just, I'm not even thinking about it. Which
Now,
probably
do you
most
sew
surgeons.
anything? Like if you rip a shirt, you're the sewer, right?
Well, so what's funny is I'm more likely to repair something with an actual surgical suture kit than I am to bust out any kind of sewing machine, because I still don't know how to use that thing.
Right.
But I
Right.
might have like a kit with actual laceration repair, and hey, if it holds,
Yeah.
it holds. Why not?
I need a gauge 2 needle here and a fine thread. I tore my work shirt. Oh man,
Yeah.
that's funny.
Oh, I've repaired a jacket with a stitch for sure.
Yeah. Wow.
Yeah.
That's like a medical gala or something like that. That's where I'd want to rip something. Like, okay, who can who's got the best, stitching here? Let's whip this together real fast.
Yeah.
Wow.
Yeah.
So with you doing, it sounds like you were still kind of like doing some residency work or in school back in 2000 or 2020 timeframe. It sounds like
Yeah, I
um
was doing plastics
plastics. Okay.
training.
So with the pandemic and everything, obviously that changed healthcare for a while.
Hmm.
And how what did you like? How was that for you? Like, because I'm assuming you probably couldn't go into the office for a while. You probably had to do
It
remote
was wild.
consultations, all that kind of stuff.
It was wild because I'm a fellow or resident, whatever, in plastic surgery. I was at Rush University in Chicago, so
Hmm.
huge city, huge impact from COVID. And when you're in training, what your day typically looks like is you get together as a group in the morning, you see all the patients that are on your service in the hospital. That could be 8 to 22 patients or something like that. It could be a lot of people you're seeing all before cases start at 7:30 or 8, and then you're covering cases the whole day, and you're operating sometimes until 9 o'clock at night, and very long days, between 60 to 80-hour work weeks. And when COVID happened, that just stopped. They were like, "Don't come in. What we're going to do is we're going to have, instead of like the 8 of you come in like typical, we're going to run it like a weekend. One person comes in each day and rounds and then gets out of there, just to
Hmm.
make sure that the people that were already in there could heal and go home." And then for a while, our census, that was sometimes 20 people, was like 2 or 3.
Hmm.
And they were stopping all surgeries, even cancer surgeries,
Hmm.
because they needed all the beds for all the acutely sick people. So it was quite a while, and it just turned into us doing a lot of these calls for new conferences. We're just creating conferences, and of course it was affecting all the programs. So there was like brand new conferences where all of a sudden every program in Chicago, Northwestern and Loyola and everybody was just on a Zoom call having a Wednesday morning conference, because what else are we going to do today?
Right.
Hmm.
And just
Wow.
trying to better ourselves without being able to be in the hospital. So that
Yeah.
that was nuts. And then I think, so that was obviously March, and sometime I think in the June to July they started allowing cancer cases to at least start. So it was slow to bring it back in, but they would at least let the breast cancer cases go so we could do the breast cancer reconstruction. Um, and it just ramped up from there. But yeah, man, it was nuts, especially being in Chicago and
Yeah.
different from hospital to hospital.
Yep.
Wow. And, okay, so my second part to that one, going back to give the listener context to what you've had to go through, Andrew. You graduate high school. You don't have to go years. You graduate high school, right?
Hmm.
And how many different schools and programs have you had to do in, I mean, it's, well, 20
Since
years,
high
right?
school. Since high school.
Yeah.
Well,
Not
yeah.
20
I
years.
mean,
What was it, like, but maybe 17 or 18
well, I was
years?
gonna say I graduated high school when I was 18, and I did another 18 after that.
Yeah.
So, so undergrad, master's, med school, general surgery, plastic surgery. So 5 different programs, 5 different places after high school.
Wow. And now, Jason, too, listener, also, like, Andrew didn't get to pick where he went. It was
Hmm.
like a lottery system. I remember that, wasn't it? Like you
Yeah,
had to do what do they call it?
they
That
call it
release
the
day,
match.
the match day,
They call it
right? And
match. Yeah.
then so like everything's been like super stressful. Like at least I mean I'm just a brother-in-law, but like match day, Andrew had like a list of 10 places he wanted to go, and somebody else matched him to wherever, right? So then he goes to that match, and then his next program he's got an interview at a bunch of different places, and then you got to go somewhere else. Like it's just like
Yeah. Yeah.
finally now being done, he's he gets to go where he wants to go, which is
Yeah.
great.
That was interesting. You go through that as a junior chief resident, 4th year general surgery resident, going on a ton of, I think I did 14 interviews for plastics
All over the country,
Wow.
all over the country.
flying all over.
And my top, I don't, in no particular order, I can't remember, but let's say my top 6 were like between Denver, Philadelphia, Boston, Chicago, Nashville. I don't know, I'm forgetting one, but I didn't know where I was going to go, and I matched in Chicago, which wound up being pretty cool. But
Yeah,
then when
Chicago was awesome.
but then when you're leaving that's like all you know, and then it's time to look for a job like most people do, and you're like, I don't know what I'm doing here.
Right. Well,
You
before
know?
Chicago, you were here. You were in Greenville.
In Greenville, yeah.
Yeah, but you didn't pick Greenville.
No, match same exact way.
Same thing.
Same thing.
Like that is that was I think when you were going through all of that process, I was like, man, he's gonna be a doctor. This is so cool. And then when I learned about this like match thing, right, I was like, wait, he's got like a top 10 list, and it doesn't matter. Like they're just gonna put him somewhere, and then he's got to move there and be there for a number of years. Whether he like it could be his number 1 pick or his like number 10 pick.
Yeah,
and it's like,
you know, the way it works is the applicant ranks all the programs 1 through whatever. The program ranks all the applicants 1 through whatever, and it just is a algorithm. The highest mutual matches, that's what you get. So they always say, if you can't imagine yourself being there, do not rank it, and then you can't match there.
Right,
it's fine. But
Nice.
would you rather not match than live in wherever?
Right.
There was a couple places that I did not rank because I would have rather waited a year and tried again than live there.
Yeah.
Right.
But yeah, it is wild though. But everyone goes through it, and it's, you know what? It's every specialty.
That's wild, man.
That's just how it works. Yeah.
So now that you're out of that, are you working? You don't have to say where you're working, but are you working for like a large like hospital or healthcare organization? Or are you doing your own practice or?
Oh, I don't mind. I work at Naples Plastic Surgery, 1250 Pine Ridge Road.
Where was that again, Andrew? I'm sorry, I missed it.
239-566-2611.
No, what's their Twitter handle?
It's actually just Naples Plastic Surgery. It's hard to forget. So Naples Plastic Surgery. There's 4 of us. It is a private practice, which is nice. So we're considered a small group private practice. But what's unique about it, and what I really love, is that if you're looking for a private practice job out of training, it's most of them are cosmetic, like 100% cosmetic. There are not major institutions here with plastic surgery departments and a lot of hospital employed plastic surgeons. So the need for all the reconstruction we were talking about is handled by me and my partner and one other guy. There's only 3 of us really in the city that do insurance-based plastic and reconstructive surgery.
Wow.
So I have the luxury of working in a smaller business without all the huge corporation type of stuff. Working with a great staff and better hours, honestly, and not as much oversight.
Right.
And at the same time, I get to do a lot of what I wanted to do, which is a lot of reconstruction. And I still do cosmetic surgery as well, which I enjoy and is growing. But while that part of my practice is growing, I'm handling a lot of the insurance stuff. And like I said, there's a lot of skin cancer reconstruction, a lot of breast reconstruction, removal of excess skin after massive weight loss, a lot of things that are just hard to find for certain people when they live in an area like this. And so I'm able to kind of serve the community that way. So it's a pretty nice find. Hard to find a job like this one where you get to do both of those things.
That's awesome. Now, Andrew, can I ask a question? Because you said it and it made me think. So you have excess skin removal, right? Is that like an organ? Can you send that off to like a burn victim somewhere, or can they keep that, or is it like meh?
Not really. So well, the skin is an organ. It's the largest organ in your body.
Aha! See, I know. That was the intern. Way to go, intern.
Fun fact. I don't know of any kind of skin transplant necessarily. So it's discarded. There are other things that for burn victims that are done, skin
Yeah, they have like
substitutes
synthetic
that are
skin and stuff like that.
synthetics. Things that are derived from animal products, and then there's also something where you can actually take a sample of that patient's skin and grow it in the lab, which is kind of a newer thing, but that's pretty cool. So, but no, it'd be too much. Probably not really necessary. When
Not
anytime you do a
necessary.
transplant, you have to be on all these meds to knock down rejection,
Right.
and not really done. But it's because we have other options for it.
Okay. Now, Andrew, I know I promised you 45 minutes. You got some more time. You're just so damn interesting. Or do you have to hop? Okay. I do have a question. Now, going through all of this, did you ever have a mentor, like somebody that you continue to like either outreach to, or somebody that like pumped you up, or like like kind of guided you and was like there for you in this process?
Mm-hmm. I think I had them kind of along the way, probably each stage of the programs that we talked about. Um, I guess one of the challenges for me, maybe compared to other people, is just that I didn't. There's no surgeons in the family,
Right.
no physicians, so I wasn't. I feel like I learned a little bit the hard way, just as far as how do you get in and all that stuff, and just how to use the counselors and the advice of friends that were doing the same thing and that kind of thing.
Right.
Just kind of a self-directed path. And then I had my mentors kind of at each step at general surgery that I felt like were like my strongest mentors, and then the same thing with plastic surgery.
Now,
yeah, and I still keep up with them.
Now, in your guest speaking, roles, when you talk to students and stuff like that, students and doctors, like, do you kind of take on, like that mentor role, like maybe like something that like you notice along the way that you didn't get or that you wish you would have had? Do you kind of add that in, like when you're being a mentor?
Yeah, definitely. I mean, that is one of the things that I kind of miss about not being at an academic center, is the ability to mentor and teach. And I enjoyed that as a resident, to be able to teach the medical students that rotated with us. So, occasionally I have the opportunity now to let somebody shadow me for a day or two, maybe somebody going into PA school or somebody just starting medical school that is trying to figure out earlier than I did, like, hey, maybe I'd want to be a plastic surgeon. So I like giving that exposure and giving them tips. And I mentor somebody by phone who's just very early on in undergrad, and just give them all the tips that I took a little longer to figure out.
Right. That's
Definitely.
awesome. That's awesome.
Yeah.
Now, this is Jason's going to smile on this one, or at least he has to now because I said it. Doctor shows, like, are you a fan, or do you look at them and go like, that is bullshit? Like, that's not how that works. Come on, House. Come on, Grey's Anatomy.
Yep.
No, that's not right. Like,
yeah, no, it's true. I kind of I lost the patience for it. I actually used to watch a lot of
patience for it
because it was interesting.
Now, one thing that I'm big on, like, so a little bit about me is I do like a lot of YouTube stuff, which is why I like making the podcast. I can't help but notice that you happen to be on YouTube a little bit here. So I see that your practice does some YouTube videos, and you have some talks that you do on there. Do you enjoy doing that kind of stuff, like teaching about the stuff to the public, and like kind of being a spokesperson for what you do?
Yeah, it's fun. It's all brand new. You don't have time for that when you're a resident or anything, because you're not. You're a servant almost. You're doing your learning, but you're also just serving the division of plastic surgery or whatever it is. So that's one of the things that was very interesting, to all of a sudden be in actual practice, and being in private practice especially, which takes care of their own marketing. So now you have to be on camera, doing the photo shoots and the educational videos, and people, patients, TS, they go to Instagram and websites and stuff to see what the plastic surgeons are doing and to learn about it.
And who they are.
And who they are, yeah. So
like, I can get along with that person, like that. They seem nice, because I mean, like, I've been to a couple doctors before. I'm just like, I wish I would have known. I wish I would have known about you before I got here.
Exactly.
Yeah.
So yeah, I'm still learning that, but it's fun. It's fun.
Yeah. Well, you're very natural at it, Andrew. You're very natural at it.
Mhm.
So now, bing, 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 bong, bong, boom, boom. We've come to the point of our show where we call it the Magic Hat. We have questions, quick fire questions from
Uh-oh.
our top hat. We're just, off the top of your head. They're nothing crazy. We'll do about 5 or 6, and you just go with it, right? They're nothing. It's nothing like what's
There's no
the
wrong answer.
massity of density and the circle of a square.
I might overthink it.
I don't even know what that was. Okay, so question number 1: if you could only drink one drink forever, other than water, what would it be? That's wild. There's stuff in here. I pulled it out.
I know. See, I overthink these questions. That
Yeah. Well,
am I
so you
gonna
got
get
water to fall back
am I
on.
gonna get dehydrated here? Like
Well,
what's
no, you got
what's gonna
You
happen?
got you got water.
You got
still.
water.
You're good.
Oh, I have
Other
to.
than water, you have
Okay.
water.
Okay.
So it's like water and something else.
Okay. Maybe like a Diet Dr. Pepper. I'm a big fan of that soda.
That runs in the
Actually,
family. It runs in the family.
yeah.
So is it Diet Dr Pepper or Dr Pepper Zero?
I'm honestly not very familiar with Dr. Pepper Zero,
Okay. Okay.
so it's DDP, I guess, for now.
Yeah.
Yeah.
Nice.
Jason, it's not really Dr. Pepper, Diet Dr. Pepper. He's just doing a placement for his mom. So that way, if this show gets picked up, we get sponsored by Dr. Pepper,
Oh, nice.
Diet Dr. Pepper, and then
You
she
know.
gets a lifetime supply. I know that's what
Also, I can't say wild turkey.
there
There
you
you
can. You can. It's just
I think that would get old.
right, wouldn't it? I think so. I think
Yeah.
you'd just be like, nah.
Yeah.
Okay, next question. Oh, give me a random fact. What, you're full of these. Give me a random fact that you know. And it doesn't have to be medical or just like I told Jason that dolphins shed skin every 2 hours.
Is that right?
That is, yeah.
That's
It's not like a
insane.
snake though. It's not like a snake. It's like their skin just flakes off. Like, could you imagine
Really?
the ocean would be full of like dolphin-looking carcasses? But it's not.
Wow.
It's just like flakes off.
Well, the last thing that I learned came into mind. We took Lilia to the zoo this weekend, and we're looking at the flamingos, and it looks like they have the backwards knees. And how do they
Right.
stand that way on one leg? It turns out that what looks like a knee is actually considered their ankle. And so they're very stable that way, and they actually spend more energy standing on 2 legs than one.
Wow.
Wow. Well, thank you for your random fact.
Anytime.
Okay, next question. We're 2 in. Oh, silence or background noise?
A little background noise.
A little background noise. Now, do you do
Yeah.
that too for surgery? You get some.
Oh, there's always music. There's always music in the operating room.
No. Do you pick it out, or is it on?
I pick it out.
You pick it
What's
out.
the song of choice there?
I'm not really that picky. Like on occasion, there's almost
Do you
like
have
a little
playlist?
there's a little etiquette. No, I feel like maybe that's old days a little bit. There was always like the playlist, and everyone still hangs on to that and says, "Oh, is this your playlist?" And no one does playlists anymore. People do like Spotify Radio or Sirius XM or whatever. And I feel like there's a little bit of an etiquette, or there's supposed to be, in the operating room where like the surgeon is the one who's in charge of everything.
Right.
They should be happy. You shouldn't just put something on that they might hate.
Right.
Mm-hmm.
But if they have something on and it's very reasonable and everybody's happy, that's the most important thing. So as long as it's not annoying, I don't ask anybody to change it.
Yeah.
If it gets old, I might say, "Hey, let's try something else." If it's me,
So enough of
I
Lana
mean-
Morissette. Let's try something else.
no,
Little
no.
enough Sheryl Crow. Come on.
I like the variety. I usually put on Sirius XM, and just depending on the mood. I mean, nothing crazy, nothing stressful.
Do you have like, if you're doing like, a serious surgery, you want more,
Actually,
you
yes.
know, like you have a different kind of
Yeah.
tune that you want to listen to?
Yeah, actually. I mean, if I'm doing something more delicate, eyes, facelift, something like that,
Hmm.
I'll put on much more relaxing, gentle music. I mean, even
Yeah.
like something without words.
God,
Maybe
could you imagine like listening to Metallica and you're like,
Yeah, no. Maybe like get too excited with that.
Right?
Yeah, sometimes that's like acoustic guitar or something.
Mm-hmm.
Wow.
But for the most of what I do, rest and body and stuff that I do more commonly, um, it can get a little mundane for the staff and everybody. You need your assistants to
Right.
kind of stay engaged,
Yeah.
not too amped up, but not like falling asleep to
Enough.
white noise,
Right.
you know? So something with variety, maybe classic vinyl
I was
on
gonna say, yeah,
Sirius
like
XM.
80 something, right?
You know, there's a new channel, Life with John Mayer on Sirius XM, which I've been
Okay.
enjoying because a lot of variety there. No Shoes Radio with Kenny Chesney. If we want a little country flair.
There we
Nice.
go.
Sometimes I
So
kick it up with Soul Cycle Radio, a little upbeat
A little
workout
upbeat.
music. Yeah.
But that's interesting that you have you know, depending on what you're doing, that dictates your music. That's neat.
Yeah.
you talked a little bit about like the playlist and stuff, but like what kind of like talking about the length of everything. What's the longest surgery you've done? I guess I'm kind of curious on that. Like, have you had an 8-hour surgery, 9-hour surgery, or?
Yeah. So not since I've been in. Well, that's not true. I've had a 9-hour surgery since I've been in practice. In training, it was more like 13 hours.
Oh wow.
Um, that's usually a really complicated microsurgery case.
Mm-hmm.
You take like a lunch break in the middle of there, like they
Yeah.
feeding you a Twinkie through your mask. Like, what's going on?
Yeah. Well, pee in a catheter. Yeah.
Yeah.
No, but for those cases, there's you're kind of part of a team.
You tag in and out. Yeah.
You'll go take a lunch break while somebody else
Mm-hmm.
fills in for you. And even here, if I ever have something that's like 8 hours, I'll break out and have lunch. But it's quick, obviously, and kind of rare. You try to take an opportunity where nothing was going to happen anyway. So let's say sometimes you're moving from, let's say, the chest to the abdomen or the face to whatever different body part. You finished one part of the surgery, they have to maybe like reposition and re-prep and re-drape and everything. You kind of take that time that was going to be kind of downtime anyway and grab a bite and go to the bathroom so that the patient's not asleep unnecessarily.
Right.
Yeah.
But the thing about plastics too is that a lot of our surgeries are 3 to 5 hours.
Wow.
Very, very
Dang.
common. So they're longer cases. You just kind of get used to it.
That's wild. Okay. Next question. Personal motto or motivational line?
I said this in an interview a while back, and I don't feel like it's really changed. And it's but I don't remember who sang this song, but work hard, play hard.
Okay.
Right. It's not the deepest motto, but I feel like that's what we do.
Hey man, a motto to
work
you is
hard.
it doesn't motto to me what yours is.
What's the motto you?
What's a motto to you?
Oh,
No,
I
it's
enjoy.
great. It's really, it means something to you, right? So that's what your motto is.
Really, put the hard work in, but when I'm having to, really just enjoy spending time with family and just really appreciating it and trying not to always bring home more work than I have to, because it's part of the job you do,
right?
No matter what, but
right,
trying to enjoy the quality time that you can.
Wow. Yeah. Okay. One more, and then we can wrap up with you. Oh wait, no, I don't like that.
I got 3 hours.
I know. Oh, this one's a fun one. This one's a fun one to end on because I know you, and I don't know this one. Do you believe in ghosts?
Not really.
Nah.
Not really. I mean, have I ever been spooked? Yes, but I don't know. I have a hard time believing. I feel like way down, the scientist in me is like, come on, no way.
Right. Right.
But I feel like I've had some experiences in the past of feeling like there was a supernatural experience, like freaked me out as a kid, but I can't explain it, but still.
Yeah.
I've never actually seen one.
Right. Have you ever gone to any of like the ghost tours or graveyard tours or anything like that? Yeah.
And they creep me out and they make me believe, but like, I guess until I see one, I don't know. It depends. Do you count like that, like negative energy and stuff like that? Does that count, or do you have to physically see one? Because I can't buy that.
I think I mean I would buy like if you're somewhere and like you ever been like watching TV and like something random just falls and you're just like how did that fall, or
Yeah.
like a door kind of like just like creaks open or something like that, like I'm more of like a ghost sign believer rather than like I'm gonna see like somebody standing at my door, right,
Yeah.
or something like that. Like I'm like
Exactly.
Poltergeist, it's a great movie but I don't think I like
If I
believe in
had to
that.
put my like, it's funny. If I had to put my money on it, I don't really believe in it, but at the same time, I could easily be freaked out by that kind of thing.
Right. Yeah. I think like the chance encounter. I mean, I believe in. I think spirits are there. Me and Jason have talked in the past. Like, we won't get into it, but like timelines and like multiversey things, and they, like if there are other times out there like that where sometimes they dipped closer to each other than and we can see that parallel universe type of thing, and that's
Yeah.
what can be construed as ghosts and stuff like that. But I think strong enough spirits could be, kind of held
Yeah.
on.
Yeah. No doubt.
It's cool.
It's
Awesome.
kind of interesting because like one of the big things that it hasn't been really studied that much in medical is the death process itself, like what happens to the brain during death and all that kind of stuff. Recently it's kind of picked up, but I've read some articles on that. And it's pretty interesting to like understanding like what's happening during that time frame and everything. It's pretty cool.
Hmm.
So yeah.
Yeah.
Wow.
Yeah. Definitely. It's a tough one. Really tough one to study.
Yeah. Yeah. Okay. So I got two more things for you, and then we'll let you go. I understand that you, and I've seen it. I can't say I understand, but you are an amazing artist. Like
Thank you.
Andrew is like
Huh?
was that a chance? That was a chance, wasn't it? Ditch
You know what?
doctor, go work for Pixar or something.
I think that's something I always thought about. You get asked, what would you do if you couldn't be a doctor?
Right.
I don't know if I would like realistically, if I had, to kick in my disability, if I would actually pursue this now. But if it was kind of like, if you were not in medicine, what would you do? I always thought that'd be awesome. Either an animator or an Imagineer or something like that. You get to use your
Right.
creativity, but also the engineering side of it. I thought about engineering when I was an undergrad, actually, because I was just good at math and that kind of thing. So I thought about it, a cool way to blend those two things, but I guess so is this. So maybe that would be a fallback.
Right. But now you use it more for like relaxing, right? Like, do you ever just like Jason the other day played video games with some friends, and like I built a Lego Ecto one from Ghostbusters. Like, do you?
I do.
Is
Yeah.
that's what you just kind of do is watch TV and you just sit there and sketch and stuff?
Yeah, sometimes, or we got Lilia some sidewalk chalk the other day. The problem is she's like, hey, draw hey hey from Moana. I'm like, that's fine, but let me concentrate. Don't talk to me. You know,
And
get
then
out of
she
my
comes
way.
over.
I'm gonna draw the hell out of this.
Right. Let Daddy do this.
Yeah,
You asked me to do this.
literally. And then she's like, I want to go. And I'm like, nope, I'm not done yet.
I'm not done. And then she comes
You
over
take
with
it
like a
seriously.
piece of purple chalk and like draws it
What are
through
you
his head or
doing?
something. What are
Yeah,
you? Oh God, I'm done. I'm done.
poor thing's 2 years old, and I'm getting you're all over my drawing.
Now with the drawing, because I know you've been doing it for a long time. I know you drew on Kaylee's wall. That was like incredible. Winnie the Pooh stuff. And
Oh yeah.
like, do you ever come? See, I've done my research. Did you ever? Do you ever come up with like Andrew originals, like your own characters or like your own like little
Uh,
comic booky kind of thing?
Nothing like like a comic book where I had like a whole series, but
Right.
we
Yeah. But like,
actually that happened during COVID too. We had this little competition with our family. I think Kristen and Kaylee, everyone like submitted a little something, and I made this own little character,
oh, I
uh,
remember this.
Bunny,
Yeah.
and some other GI Joe looking guy.
Right.
Yeah, yeah,
Okay.
that was
So
fun. That
so
was fun.
there's originals in there.
We didn't know what to do. Yeah, I just
Yeah.
found it actually like a month or two ago. I found
So
those
there's
drawings.
originals. There's originals up there. That's awesome.
Yeah.
That's awesome. Okay. And then now I do have one last question for you. Your name is Andrew, right? I know I'm a Nicholas. So I know that there's a Nick, a Nikki, an
Yep.
Olas, Nick,
Yep.
Andrew. I can see that you put Andrew on here. Are you anything but Andrew to anybody else? And do you care?
Yeah. I don't go by much else, like for most people. Nobody does Andy or Drew really.
Just
There's
because, or
more.
every time they say, "Hey, Andy," you're like, mm,
No, nobody takes a leap on Andy, really.
yeah,
I don't know. Um, I guess starting in training, like you go by your last name a lot, so there's been more variations of Bonnet
right.
and just Bon, or
Abo.
the Abo was a thing from college, kind of like J-Lo or A-Rod. Um, so Abo was a thing. Some of the newer medical assistants and nurses that we have started calling me Bonnie. Not to my face, but that's how they refer to me to each other,
Behind
as
your back.
Bonnie. Yeah, but then I found out about it. Those are the big ones too. And then, whatever. When my wife wants to make fun of me, she'll probably do,
Andy.
fill
She
in
tried to get that going for a little bit, and we're like,
Ange. She used to
Ange,
call me
yeah,
Ange, which she just
Ange.
knows I think is annoying, so she does it more.
Yeah. So like I can say like Jason. Jason, I thank God love him. Listeners, we've known each other for probably just as long as I've known Andrew. And he's Jason, he's Jay, JJ, Uncle Jason, little Jay, little
Mhm.
Jason. Like
Mhm.
I call him all kinds of names and he answers to all of them.
Yep.
Like
Yeah.
do you do you have a bet, like are you just Andrew? Like to your best friends, like are you like you're just like
Yeah.
I'm like Jason shows up and he's like, I don't know what I'm gonna get called tonight. Probably 15 different names from Nick. Like
Yeah.
or
I
is
think I
like
think I
Ryan
think
just
it,
like Andrew?
at Ryan,
Yeah.
like Ryan will call me Abo still from
Yeah.
college. He'll be like, Abo. Yeah. He'll just go for it. And then certain other people have their own thing. Like my buddy Phil will call me Bon. Um,
I think
I
it's
guess
fun.
everyone has their.
Yeah.
Yeah. It's
Yeah.
great.
Yeah.
I'm not going to correct anybody, but when anybody asks me, like, do you do Drew or Andy? I'm like, nah, you can
Nah.
start with Andrew until you feel comfortable enough to make up your own thing.
Till something comes up, right? Like
Yeah,
till something comes
exactly.
up. That's yeah, and
Exactly.
you know what's funny is you don't look like an Andy. I've met an Andy before and he looked like an Andy. Like I looked like you looked at a guy and you're like, meh, you're an Andy.
A
You don't
great
look like a
buddy.
Drew.
Yeah.
You look like
That's
an
the
Andrew.
thing. I've known a lot of Drews and a lot of Andys, and those are separate names for me.
Right. Yeah.
I don't
Yeah.
know. It's what it
Okay,
is.
so now what last thing, and then Jason, if he has anything to chime in, he can. But like, so what does Dr. Andrew do? What is he watching? What's a good series that you're on? What's a movie that you just saw that you recommend?
Mm-hmm. Mm-hmm. Uh, I am a fan of right now Curb Your Enthusiasm.
Okay. Larry
Ted.
David, funny.
Yep. Ted Lasso.
Mm-hmm.
I like
I
to
got a
follow.
compliment the other day. Johnny, everybody knows Johnny, my buddy Johnny.
Yeah.
We were talking the other day, and he's watching Ted Lasso, and
Yeah.
he's like, "Dude, Ted Lasso's so awesome. I love Ted Lasso." He goes, the main character is so upbeat. He's always got something stupid to say to make somebody smile, and he's like
Yep.
always like very animated stuff like that. He goes, I can't help but think of you every time I watch Ted Lasso, and I'm like,
That's cool. That's
what?
cool.
I've never seen Ted Lasso. I don't even know anything about it. And
It's
I mean, I
good.
know it's Jason Sudeikis. That's it. But I was
Yeah.
like,
It's true.
I was like, Johnny, that is so not like. I'll take that as a compliment because everybody loves Ted Lasso.
That's
So
true. That's
I'll
true.
I'll
That's true.
take it.
Absolutely. So yeah, we love a good like thriller murder mystery miniseries. They're coming out all the time, like True
Right.
Detective, or
That's
we
I
just
think that's the trend now. Is the
yeah,
murder?
those are the
But now it's
ones.
like the comedies, like the Clue, like Only Murders in the Building, like where it's like comedy and murder,
Yeah,
and stuff like that. So I think it goes dark, like you said, like Cold Case or True Detective, and then you have like
yeah,
funny murder comedy. So
yeah,
yeah,
yeah.
it's
We
got
just
to be
started
decent.
Sugar. This is the new one on Apple.
Oh,
Okay.
That's pretty good. We were big Yellowstone fans.
I got to get into that. We just got Paramount.
That was good.
Yeah.
Um, I still miss Game of Thrones, and I didn't think that the House of the Dragon was too great, but
Right.
I still have to give it a shot.
Yeah. Oh man.
Game
Like,
of Thrones was great.
I
Yeah.
just watched Peaky Blinders. That was a good one. I really
Yeah.
liked Peaky Blinders. That was really good. I just
Yeah.
finished. But it was one of those, again, the ending didn't make me mad, but it didn't also end either. I'm not to ruin it to anybody. It wasn't a bad ending like Seinfeld or something like that. But that's like one of those things when you watch so many seasons of it and you're just like, damn it, they ruined it. Like, I hate that.
I know, and it's tough when it ends that way,
Yeah. Wow.
for sure.
Yeah, no. Oh, I'm watching one, Andrew, called Resident Alien.
I heard
Have you
about
heard
it.
of that one? It's got
People
that
at
one
Costco
guy.
talking about it.
It's got the guy that does, like, he's King Candy
All
and
the
Hey
voices.
Hey, Alan Trudeck.
Yep, from Firefly.
Yeah, he's
Yeah.
so funny, but he's an, if you don't know, he's an alien, and
Yeah.
he kills a guy that's a doctor in a small town, and he has to be the doctor, and he's like
Yeah.
watching like Google, like YouTube, before he goes in and does something, and it's just funny. But it's a little like a small
Yeah.
part of the show, but it was
Right.
he's watching, he's like, I am smarter than you, and yes, I could do that.
I've heard a lot of people that watch it and say it's
Yeah.
great.
It's funny.
He does a million voices. I always think of him from Dodgeball.
Oh
as
yeah,
the
Pirate Dan,
pirate.
wasn't it?
Yeah, exactly.
Yeah. He's for me, like Andrew, your artistry would have been my voice actor. Like that's what I wanted to do.
Yeah.
Was be a
Oh,
voice
dude,
actor,
for
right?
sure. You
And
could crush that.
but like with voice actors, like the guy that does Winnie the Pooh, right? Like I only hear
Uh-huh.
him as like Pete. Like he sounds like Pete to me because he does Pete
Mhm.
too. Where like Alan always sounds like when I'm watching Resident Alien, I'm like, you're King Candy. Like that's
Yeah.
where you are stuck now, right? Versus like Kung Fu Panda, where Jack Black just sounds like Jack Black as the panda. It's like, okay, well that's not anything different. But like people that do like multiple voices, I find like sometimes I get stuck on that
Yeah.
one, and I'm just like, nope, you're just pretending to be these other people.
Yeah. You ever realize how much we probably don't realize how we're such Disney focused? Those are like the first examples we think about.
Right.
I grew up in Orlando. You worked
Mhm.
there. We have daughters.
Right.
Those are just like examples. King Candy, like half the people are like, who's King Candy?
Who's King Candy? I mean, if you haven't seen Wreck-It Ralph, you're living under a rock. I mean, that's a fantastic movie. That's a good one. That's a good one. That's King Candy, and I'm going to get that Wreck-It Ralph. You know,
There you go, dude.
Yeah.
You could do the voice
That's
acting easily.
spot on, bro.
watch out, Alan. Here I come. Yeah. So that's awesome. Well, Andrew, I really appreciate you taking this time out to talk with us, and I hope you had fun. I know I did. I learned a lot more about you.
Yeah, appreciate it.
I feel like dinner next time is going to be a lot more fun, and and I hope our 4 listeners learn something too. So that's awesome. So I do appreciate you do. It does mean everything for you to be on episode 2 of this long-lasting Details Untold. I feel like
What an honor.
I feel like there wasn't a detail that was untold tonight. Like I feel like we know all of Andrew's secrets.
Choose your lucky number, man. You got the second year residency doctors from UCF, and then now you're second on our show. You know,
There you go.
Second episode on the podcast. That's awesome. Way to go.
Yeah.
Well, thanks so much,
That's
Andrew.
yeah, thank you, Andrew.
Guys.
Talk to you
Take
later.
care.
Have a good one.
Wow.
Oh,
that
was
was
awesome.
fun. You
That
know,
was
you think you can cover somebody's life in 45 minutes, with pointed questions, but sometimes they're, you start big and then you start working your way down. And as long as they're willing to give you that information, like again, Jason, like we found out that music plays a big part in people's lives, like with Dave and Adam, and now, with Andrew, even with surgery, it makes sense. He's not listening to Disturbed and Metallica while doing facial reconstruction, He's listening to cool jazz and, and Beethoven and stuff like that. Like, that's so cool to me. Like, that's it's neat how much music has effect on people.
Yeah, no, it was really cool, and like it was neat because I've met him a few times, right? Like,
Right.
you know, at
Throughout life.
the yeah, you know, at the birthday parties and stuff, and a couple times at Disney. But it's cool to really learn more about him because he's pretty interesting. And we just touched the surface. Like we didn't get into like the drums
No,
or
we
music
touched
or
on
any of
it.
that stuff. We
Yeah.
touched on it, but didn't really get into it much. So
Yeah.
yeah, I'd like to have him back on sometime, and we can dive into more stuff later
I
on.
know. I mean, we could have kept him on, and
Yeah.
but you know, there's always a part two.
Yeah.
You know, right? And by the way, he said, next time we should have made it a drinking game. Naples plastic surgery. Naples plastic surgery.
Yeah.
We can tag it. You know, he's a great doctor. He's really good with his patients and stuff like that. And it's wild. Like I just when I was asking those questions, he was telling me like it's like what he does as a plastic surgeon
Mhm.
is he's like that's really God. He's got to feel so good. Like
Yeah.
the confidence and stuff like could you imagine leaving work? Like you come into work and a guy comes in a wheelchair,
Yeah.
and because of you, he can walk out the door.
It's got to be so rewarding. I mean, yeah,
Wow.
yeah.
Like
You're
you just
literally
gotta
changing
walk
people's
into the
lives,
house just like, hello, honey, hello, child.
right?
Today's a great day. Like, wow, that's
Yeah, no,
beautiful.
that's awesome, and yeah, I know it's pretty cool. I mean, and the other thing too is like for me, like whenever I go to the doctor, like I can't tell you probably the last like I can't actually remember since maybe when I was a kid. Every
Right.
doctor I've seen since then has been, oh, in and out, very unpersonable, like,
Hmm.
like don't want to talk to you. Like he mentioned he's a hugger. Like that's
Right.
not any doctor I know.
Right. I
So like
know.
that's
Like,
really cool. Like if
wow.
he's just so personable and it's
And
that's a huge
willing,
yeah,
right? Yeah.
that's a awesome
I know
trait to
Andrew.
have.
He'll sit down and he'll talk sports and golf and all this other stuff with people, you know, and then be like, "Oh yeah, you came in here for a reason," you know.
Yeah.
And he remembers stuff too. I guarantee it. Like if he talks to somebody about the Masters, and then they come back in 2 weeks from now, and there's I don't know how golf works if there's part two of the Masters or whatever. Like he'll
Mhm.
remember and bring it up again and stuff like that. So I know that's the kind of guy he is. So I feel real honored to have interviewed him. And again, I don't feel like we left any details untold.
No, definitely not. Definitely not.
Awesome, man. Well, hey, talk next time. This was
Yeah.
fun.
Yeah. Until next time.
Till next time. You have a good night, sir.
All right. You too.
Bye.
Bye.